It's the debate that goes on in every injured runner's head. Is my injury bad enough to get medically assessed? After all, it's such a hassle to organise and probably costs too much, and they're just going to tell me not to run, which I'm going to ignore anyway. Well, step 5 of this 10 video series will help determine if your rehab needs a helping hand. And if it turns out you do need to enlist additional help, I'll be sharing 5 helpful questions to ask your health professional to make your consultation more effective and see if the person you enlist is a keeper. If you've watched the first 4 videos of this 10 video series, great job. I hope each video is changing the way you think about rehab because these lessons aren't taught anywhere else. If this is the first time you're hearing of these 10 stages, head to the playlist and start step 1. By now, you have your practical rehab ladder and you're climbing your way back up to pre-injury capacity. And if you can overcome your own injury just by watching this content, that is a huge win, and this video series has served its purpose. But I also understand that for some, you may need some extra assistance and expert guidance. For example, you might be struggling to identify a diagnosis or any underlying reasons or causes behind your flare-ups or any setbacks that you have. And let's face it, the best approach is always the one with tailored guidance. That way, your rehab is specific to your injury, its severity, the goals that you have, and your lifestyle. This is what step 5 is all about, seeing if your rehab requires a health professional to step in. Let's go through a checklist based on the previous videos in this series and see if you need someone to step in. Checklist number 1, you are clear on either the diagnosis, the reason for the injury, or confident on the aggravating factors. 2, pain during running and or your rehab exercises is less than a 4 out of 10. 3, symptoms return to baseline quickly after activity. Less than 24 hours is good. Less than 12 hours is even better. 4, you are confident with your rehab ladder structure and also progressing your rehab exercises and bridging the gap to meet your goals. And 5, your symptoms are improving week by week. If you've ticked all of these boxes, no assessment or assistance is needed. If you haven't ticked all the boxes, start changing your management until all the boxes are ticked. If you've tried for a few weeks and still can't tick all these boxes, get it assessed by a professional. Let's go back to Cody's rehab journey. So far, he's found that a 20-minute slow run causes about 2 out of 10 pain, and symptoms return back to baseline in about 6 hours. After reviewing the advice in stage 4, he has progressed his wall sits to half range of movement squats and weighted step-ups. All of these are ranging within acceptable pain limits. But also, he has ideas on how to progress and eventually build towards his goal, which is running 10Ks. He sees steady improvement for 2 weeks, but then encounters an unexplained flare-up in the 3rd week. This is also followed by 3 good weeks and then another unexplained flare-up. Seeing this trend over the past 7 weeks, it seems like something needs to change in order to see a stable long-term trend. So, Cody jumped on a free injury chat with me to discuss his situation and his frequent setbacks. Looking a little bit deeper into his rehab plan, it seems that these setbacks occurred the day after gardening, which requires a lot of squatting and kneeling. We then worked out some modifications to his gardening habits to then keep his recovery moving forward. This injury chat is available for you too, and it's really easy. Just click on the free injury chat link in the description or find the link on my YouTube banner. But if you'd like to see a local therapist for your injury, allow me to help you with some helpful questions to ask to make your consultation more effective. Question number 1, ask for a likely diagnosis. While a diagnosis isn't essential, most running-related injuries can be diagnosed with some simple provocation tests and without medical scans. Once you have a diagnosis, you can then do your own research to see if the pain location and the behavior fits your symptoms. Question 2, ask about your recovery roadmap. While it's often hard for a therapist to know how long it will take until you have full recovery, they should have an idea of the roadmap back to pain-free running. If they mention something that resembles this rehab ladder, you're on the right track. Question number 3, if you're confused about the original onset of your injury, or if you aren't clear on why the injury is behaving a certain way, ask some questions to your health professional. This is a good opportunity to also clarify anything in the roadmap that you're unsure of. Number 4, if you aren't satisfied with any of the answers, ask it again. Certain therapists can often reply with complicated medical jargon and use terms that might be confusing. But at the same time, if a therapist is unsure of an answer, their response to the question will be quite vague. So don't feel stupid or polite and just sit there silently. Ask them to rephrase their response or ask more questions. Keep asking until you have a clear answer. And lastly, the 5th and final question I want you to ask is how likely a flare-up would be when following this rehab plan. Also ask what elements could increase the likelihood of a flare-up and what to do if you have a flare-up. This is such a crucial piece of the puzzle that I wanted to dedicate step 6 to explain the general principles of understanding and managing a flare-up effectively. So, I'll see you there.